A public health expert, Tuyime Bawandu, is here to discuss this. Good morning, and thank you for joining us on TVC Breakfast.
Good morning.
All right, although WHO seems to be taking this issue by the reins now, it is heading, championing the cause, especially in China and across the world, and it has named the coronavirus COVID-19. And a lot of persons have come out to say that it is important that a name is given. But let's look at how so far countries with cases have handled the case so far. How would you evaluate it?
Again, we've seen the response, at least haven't declared it as a public health emergency of international concern. The WHO has taken the lead in trying to direct the fight against the coronavirus. Now, 71,000 people, 1,800 deaths in about 30 countries. If you add the ship to it, that means about 31 countries in a way. So the pandemic is hitting us and hitting the world hard because, again, the total understanding of the dynamics of this virus is still unknown. It's still an unknown entity. The incubation period is not known. The contagiousness is not known. And then even how this thing actually really transfer from one person to another person is still a subject of some speculation to a large extent. Now, we are going to be facing a lot of epidemics. There's no doubt about that. We're not going to see a reduction in epidemics. Coronavirus is one. We understood that it's mutated from it's a mutation of one of the coronavirus family that causes a common cold to what we are seeing in essence. Now, why are we then seeing more of these epidemics? It's simply because we are not paying attention to critical issus that we need to pay attention to.
What are these critical issues?
Okay, one, the starting point of epidemic detection is actually, from the primary health care center. Okay, because surveillance is the starting point. Now, the primary health care center is the basics of surveillance. The world has kind of turned their attention away from discussing epidemics. One, because there are quite a lot of people that are not under the radar of essential or affordable health care. Universal health care, because look at Africa, for instance. 85% of Africa in rural areas don't have access to essential health. 4 out of 10 in sub-Saharan Africa don't have access to essential health. We're going to see like 100 million people who is going to become poor because they are paying out of their pocket for essential health services. Now, a lot of these people run away from the health system because they cannot afford to pay. And then you need a very detailed person, a health expert, to pick an epidemic. So when they're not reporting...
But we saw that happen even in China, and that was why a lot of persons have come out to say that perhaps if there was enough transparency, because even the doctor that raised the red flag with regards to this was threatened. His life was threatened at some point. Unfortunately, he died. So are you saying that if the information, if there was some sort of transparency, whenever we hear about issues of this magnitude, action must be taken, and it could help in trying to curb the spread of things like this?
Indeed, one of the reports says that the Chinese president knew about this thing as early as January and devastation, what could happen, but they kept quiet. That is why openness and transparency is essential in public health. You must be able to communicate because, you see, when something happens in one part of the world, because in reality, at any point in time and at any time, we could see an epidemic coming out of any country because of some of these factors that we were listing. Now, transparency, openness, collaboration is key if we need to deal with that. Of course, we have Africa Center for Disease Control that, what they are doing is they're thinking about system building. But they have to also do more because at the end of the day, they are just like appendage of other system, which is promoting the interest of other system. We're not seeing much from them. The best we've had from African Center for Disease Control in the recent time is a press release. I mean,
what can they do? What are you expecting them to do beyond the press release?
At least we must be able to create preparedness, because the key thing is we have to, you know what Center for Epidemic Preparedness and Innovation is doing? They push out as much as $6 million within 16 weeks for anybody to develop vaccine. Okay, that is action. That's being proactive.
Okay, so
you cannot just come
Nigeria
and say
has put some amount of money on the table for anyone who gets the cure to coronavirus.
Cure to coronavirus, even the H1N1, even the bird flu. There's no cure for those things. Even those ones, we don't have vaccine for them yet.
Even Lassa fever, we have been dealing with for 50 years or more.
Lassa fever, you know, a bank manager who is the sister to a friend of mine died in Kebbi State just a few days ago from Lassa fever. So again, you see, we have critical issues that we need to attend to. But if we want to say that, okay, we want to pretend it's not my portion, then epidemic will come. It will spread because of all these challenges we're seeing.
So how do we move from here now? We see that we've been having discussions, and there are talks about collaborations even amongst West African countries. How critical is this to dealing with this issue head on, even if you say that we are not being as proactive as we should?
Let's face it, epidemics is not just a health challenge. It's a business challenge. It's an economic challenge. It's a national strategic challenge. Now, it is obvious that even companies that are doing business all over Africa and the world should be able to understand how epidemics can impact negatively on business. You see what is happening in China. Businesses are closed down.
Yes.
There's no travel, no trading. Companies are closing down. So we should be able to understand the connection between proper epidemic preparedness and other health issues and business and development and, you know, and even reduction of poverty. So now what we need to do, we need to actually come clean and say that, listen, we're to a large extent helpless. Company, what can you do for us? A private individual, what can you do for us? Let's
just be truthful with our situation and know what to do for us.
Yes, what we need to do for ourselves. But as we are thinking about that, we need to focus on those key prevention, key discussion, you know, and key education to ensure that people then embrace the best health practice.
Dr. Tuyime Bawandu, thank you for speaking with us this morning. Public health expert Tuyime Bawandu is here to discuss this. Thank you for joining us on TVC Breakfast.
Thank you.
Well, the West African Health Organization is in support of what WHO is doing, but while speaking to Nigerians, prevention is one of the major issues they have, major focus they have been harping on. And the fact that we have a case now in Egypt, many are concerned that when you go to our airports, yes, there are checks, but they're saying that it's not as critical as it should be, that some persons are just allowed to walk away. How worrisome should we be now that we have a case in Africa?
Yeah, we know that it's a matter of time before coronavirus announces itself in Africa. And again, Egypt, we know that we have a lot of connection and movement between here and Egypt. Now, we cannot solely rely, the airport screening is very important, but we cannot solely rely on the airport screening to deal with the spread of the virus in Nigeria. Because even countries with the very strict airport protocols still have the virus. Of course, Canada, US, you know, France.
Absolutely.
You know, they have very, very strict, you know, port health services and still they still get the virus. So again, what we need to do is a synchronicity whereby, yes, we've asked for help, which I suggested earlier, that, and then China has sent some of the equipment to us for us to be able to test for the virus. We've been talking about it because, let's face it, we are yet to fully understand the whole dimension of this virus. So at our own level, what we need is to step up the campaign, embrace hygiene, and as much as possible, you know, get anybody that is sick to a health system that can detect whether this person is just having malaria or cold or most likely coronavirus. But let's face it, the first point of announcement of this epidemic is usually in the health system, within the health system. If the health system is not tidied up, you cannot easily pick up your surveillance. Now, the basic health system that should do that is the primary health system. The primary health system is the first front to pick diseases. But look at Nigeria, 30,000 primary health system, more than 30,000, about close to 30 to 40,000 primary health care system in Nigeria. Less than 20% of them are functional. Yeah. So we are, these are the areas we should look at. Because tell you what, building a hospital within 2 weeks is not the solution to coronavirus.
How would you grade the information that is reaching the lower areas, the rural areas, because these primary health centers are supposed to be in the rural areas mostly. Now,
even in each ward.
In each ward as well. The level of information getting to that area, how will you grade it at this point? Are we doing very well as regards this coronavirus? Because not all of them have the luxury of satellites to watch what's happening in the international community.
Or access to phones.
Yeah.
The greatest challenge, even to health system and to any country, is ignorance. You know, ignorance will kill, ignorance will mess up your system. Now, I'm expecting that at this point, we should have translation of some pamphlets or even jingles into the local language where the people can deeply understand. But look at it now. The sub-Saharan Africa, only 4 out of 10 people have access to even this defective, you know, primary healthcare system. How do they now respond? And even when they get there, they don't have money, you know, there's lack of access. It seems the pathogens are taking over the whole world or whatever it is, and it will increase. They have financial challenge, they don't have financial access. Even when they get to the hospital, you know, the quality of care in the primary health care is suspect. So for us, if we really want to deal with any epidemics, which of course will increase, like I said, we need to sit down, look at the primary health care system, involve our as much. We must go as local
the president
as possible.
at some point last year promised about 10,000 more healthcare centers. How much impact would that make?
It's not just about building. It's about what is available in the building, where the human resources to staff it, where's the finance. You know, what we've seen in this country essentially is this. We tend to treat health as a cost that must be curtailed. Health is an investment that must be nurtured. Now, let me explain. Now, if you get to the hospital and say that, okay, you know what, your care is going to cost you 100,000 naira, you shout, oh, what do I need it for? But in reality, you are looking at it as a cost that should be curtailed. You are not looking at it as an investment that if you are healthy, you can do much more. You can achieve much more. The country can achieve much more. The business can achieve much more. You can see what the coronavirus has done to the aviation sector. You can see what it has done to companies, closing them down.
And the economy.
And the economy. This thing is probably going to get worse as epidemics.
So the money is set aside, sorry about that, by the government, talking about over 600 million naira. How would you expect the government to go about expending it?
For what?
For this coronavirus.
For the preparation towards
what are they going to use 600 million naira for in a country of 200 million people? What are you going to use 600 million naira for? Again, we have to get to the basics. What are you spending the money on? Okay? Now, because the budget performance, anytime you look at the budget and say, okay, we need some amount of money for health. The Abuja Declaration specifies 50% for healthcare. What do we get? We've never gotten to 5%. Which is sad. So if you're not building your system, you think that you just bring 600 million and want to throw at, what are you throwing it at?
That's why I asked the question.
To buy face masks?
That's why I asked the question. How would you expect?
To buy soap to wash your hands? You know, the government must really go back, you know, and push for information, critical information that can empower the people to take decisions.
At least there is an amount being set aside now. That's why I'm asking. What do you expect the government to do with it?
Well, again, basically, what the amounts can do is simply to push information, you know, and to help to signal and enlighten the people on what should be done to buy basic equipment, at least.
That we are not doing yet.
Well, we must have gone through the airport. You see that there's nothing really much happening.
Yeah.
But then you know, we must be able to track a lot of this money. Is it serving the purpose? Are we having the bank for the box we're putting in place? So, and then you will see challenge of release of those funds, because again, it's not just about talking about fund. What is our budget performance, especially as health is concerned? Okay, so these are critical issues that we need to.
All right, at this point we'll have to leave it
here.
At this point, but the conversation will continue.
Thank you to Yime Bawadu for speaking with us.
Well, public health expert Yime Bawadu is here to discuss this. Thank you very much for joining us.
Thank you.
Now you can see from the story we read that a cruise ship, some passengers on board are now infected with the virus. There's much concentration on airports in Nigeria. What about the seaports?
Yes, There's a health facilities which actually should be managed at the level of the master and MPA to ensure that issues concerning health at the seaports are resolved. But like everything, we just hope that these things are being done and being done properly. Now, as far as this epidemic of this coronavirus is concerned, every aspect of our life, every aspect of inflection into Nigeria must be guided. Land, sea, airports. We just have to keep the vigilance above board. We can't just be complacent, because complacency means that when the virus enters here and then we control it will be a challenge, fund will be a challenge, human resources will be a challenge, and then we don't want, because again, the fatality rate of this coronavirus is very high, though we don't really know, but it's very, very high, obviously, it's very high, but good enough, we are not at the level of the, about 100 years ago, the flu came, Spanish flu came and killed 50 million people in the world. So everybody is wondering, when are we going to get the next episode of pandemic?
Do you think that this could generate into a pandemic with the way things are going?
Again, once you move from one country to second country to third country and you cross continent, it's already a pandemic. That is why it is essential that we need to discuss it at a cooperative level.
But with the fact that there is no much information as to all of this, especially with the virus, how will countries take measures, especially for Nigeria? What measures do you think we can be taking when you don't have as much information with regards to the coronavirus?
There are basic principles for every epidemic, and that is what we should, hammer on. The basic principle is that you have to surveillance. You must pick the virus as early as possible, the disease as early as possible. You must educate your people, and you must either provide a quarantine or a treatment, options for the people. So at our level, of course, WHO is leading the pack, trying to coordinate every information concerning the virus. Now, and then, researches are going on. CEPI had committed about $6 million to look for vaccine, and a lot of incentives are going on to help, characterize this virus and understand it. So, but at our level, when we collaborate with these people, the African Center for Disease Control is there, Nigeria Center for Disease Control is there. These are collaborating, and then the other centers that can collaborate together and look at what we need to do. So, if we do our surveillance, if we alert our medical and people around the country, if we then step up our personal hygiene, and of course, basically, wash your hand as much as possible, what we call respiratory hygiene. You don't sneeze. If you have to sneeze at the curve of your elbow or on a kerchief or tissue paper which you are going to throw away. If you know that you're having cough and catarrh, cover your face, and then maintain hygiene and wash your hand properly. Eat nutritious foods to build your immune system. And if you're sick, don't go to Alagbo. Don't go to, please go to, because no Alagbo can pick that kind of disease early.
Yeah. So
you need to go to an hospital where somebody is going to look and be able to have an understanding of
talking about feeding, sorry Theophilus, at this point, we see that there is a clampdown, even in China, we talk about animals, especially the animals market. And when the West Africa Health Organization also talked about people avoiding raw meats and all of those. So talk to us with the aspect of feeding. What should people avoid at this point?
What we know is this. First and foremost, you have to minimize your contact, with live animals, and even in the slaughtering process, because again...
Are we talking about pets now?
Oh, pets are actually, to a large extent, excluded. We're not seeing the pets being a carrier of coronavirus. That's the study has shown that for now, okay? So it's not about your pet. But again, we know that most of these zoonotic diseases jump from animal to human. Now, Wuhan market was the epicenter of this thing. So what hygiene are we maintaining in our markets, And then because when you see where people are taking wild animals, have to eat snake, eat baboon, eat donkey, eat all sorts of animals. And then you know that you're likely going to contact those things. And then we must be able to teach these people, those hunters that need to kill those animals, the proper process of getting those things done. So, and then you must cook your food, cook your meat, your fish, your egg, cook them very well before you consume. So at your own level, that is what you can do.
All right.
But the bigger picture is when the whole world can collaborate. Because let's face it, epidemic will come and will come often and often. As population increases, as climate change, as we travel all around the world, the risk of picking germs and taking it around the world is very high. That is where the world is. We can't allow pathogens to take over the world. We must assert ourselves and cooperate. And create fund, what I would call fund for emergency preparedness, for epidemic preparedness. There must be a fund to drive such, or else the business will be hurt.
All right, thank you very much, Team Ebonde, for talking to us on this.